country. In the meantime, the Omicron variant causing this now fifth surge of COVID. And as the numbers show, it is starting to tax many hospitals. Our Alyssa Donovan is live in Maywood tonight to show us how local medical centers are dealing with the quick increase in patients. Alyssa.
Good evening, Ben and Lourdes. Loyola University Medical Center, one of the many area hospitals that is responding to this rapid surge in COVID-19 patients. Hospital leaders tell me that they have seen a 20% increase in hospital admissions of COVID-19 patients in just the last week.
We've seen building of COVID numbers since right after Thanksgiving, but I would say over the last 1 to 2 weeks, we really have seen an explosion of COVID.
Dr. Kevin Smith is the chief medical officer at Loyola University Medical Center. He says the numbers they're seeing are alarming. A quarter of their ICU beds now filled with COVID patients. Their ICU capacity running dangerously thin as non-COVID patients also continue to need care.
That's on top of all the sick patients that are coming to the ED, the patients that are coming to us for things like surgery and other acute needs. So that, it really is building to really this sort of crisis level, I would say.
The crisis felt across the state, but perhaps most severely in Will and Kankakee counties, where 95% of ICU beds are occupied. As of today, only 6 of the 133 ICU beds in the counties are available. Only 11% of ICU beds are open statewide. The Illinois Health and Hospital Association issuing a statement saying, in part, across Illinois, hospitals are experiencing a fifth surge of COVID-19 patients and using lessons learned over the last 2 years to best care for those patients and expand capacity as needed. Unvaccinated individuals continue to represent a vast majority of COVID-19 hospitalizations. Dr. Smith says the surge made that much more challenging due to the large number of people who have left the healthcare workforce over the past year.
You take that, you compound it with what seems like a large number of patients seeking care again after COVID sort of died down, and then all of a sudden COVID bubbling back up again. You put that into it, and it becomes, in many ways, a perfect storm. Just thinking about our capacity for beds, as well as just the strain that we're already putting on very busy workforce as well.
And Smith says they're not keeping any official tally here at Loyola, but he does believe that a majority of the cases that are coming in and getting admitted to the ICU are people who are not vaccinated. He's requesting anyone that can get their booster shot do that to help take the strain off of local hospitals. Reporting in Maywood, Alyssa Donovan, WGN News.
All right, Alyssa, thank you so much. Well, there is a fight.